Hello and welcome. Today, we are going to dive deep into the topic of heart attacks. Also known as myocardial infarction, heart attacks are one of the leading causes of death worldwide and must always be treated as a critical emergency. Given the widespread fear surrounding this health issue, it is crucial to understand it better. We will explore the causes, symptoms, and treatments of myocardial infarction. If you don't want to miss any important information, make sure to subscribe to my channel. I will explain how to quickly recognize a myocardial infarction and help those affected. This is very important. Of course, we will also talk about prevention and risk reduction, as these are essential for your health. Symptoms to know to immediately detect a myocardial infarction. The main symptom is chest pain, also known as angina pectoris, often described as pressure or tightness in the chest. In men, this pain is generally more intense, while in women, it can manifest as an uncomfortable pressure sensation. It is crucial to know this difference. In case of suspected infarction, pay attention to these chest pains. If you experience unexplained chest pain, it could be a sign of a heart attack. Another important characteristic is the radiation or spread of pain, which may not seem related to the heart. This includes pain in the shoulders, left arm, jaw, and back. The pain typically spreads to the left side of the body, but can also affect the right side. Other symptoms may include nausea and vomiting. These signs may not initially seem related to a heart attack, but are important to recognize. The American Heart Association emphasizes the importance of recognizing these symptoms to act quickly and reduce the risk of serious complications. You could have a heart attack without knowing it, called a silent or atypical heart attack. Women, diabetics, and the elderly may present atypical symptoms, complicating the diagnosis. These individuals may not feel the classic chest pain. Only a doctor can differentiate this from angina using diagnostic tests. In case of a heart attack, other symptoms may include sweating, anxiety, a sense of impending doom, or disrupted blood circulation. This fear of dying is common. Even slight chest pain or pressure should be taken seriously, and you should call emergency services immediately. So, what should you do in case of suspected heart attack? Always remember. First, call emergency services immediately. Second, calm the person affected, as they are often terrified. Keeping them calm helps normalize their breathing and prevent hyperventilation. Third, elevate the upper body and loosen tight clothing, such as a tie or collar. Finally, if there is a loss of consciousness and no breathing, you must start resuscitation immediately. Keep these 4 essential steps in mind in case of a heart attack. Definition of a heart attack. What exactly happens in our heart during a heart attack? Simply put, the heart is a muscle that pumps blood throughout the body and needs a lot of oxygen to function properly. Cardiac tissue is traversed by many blood vessels, including coronary arteries, which supply the heart with oxygen-rich blood and nutrients. However, in the case of coronary artery disease, plaques form inside these vessels, narrowing their diameter and thus reducing blood flow. Heart attacks are usually classified based on changes observed on an electrocardiogram, ECG. During a heart attack, an ECG is systematically performed to determine if it is a STEMI, ST segment elevation myocardial infarction, or a NSTEMI, non-ST segment elevation myocardial infarction. In the case of a STEMI, the artery is completely blocked, while in an STEMI, some blood flow is still possible. The ECG results then influence the treatment that will be administered. Causes of heart attack. In summary, a heart attack can be caused by various risk factors. The main factor is clearly atherosclerosis. Simply put, in 90% of cases, an unhealthy lifestyle and unfavorable genetics lead to atherosclerosis. And what happens then? The plaques formed, or cholesterol deposits in the vessel walls, not only disrupt blood flow by narrowing the coronary arteries, but can also form thrombus, small blood clots that can detach, move with the blood flow, and block smaller vessels. These thromboses are the cause of a type 1 myocardial infarction. In the case of such an obstruction, cardiac tissue, the myocardium, dies if the heart remains without oxygen for about 15 to 30 minutes, leading to the symptoms of a heart attack. However, there is a second type of infarction, type 2 myocardial infarction triggered by an oxygen deficit. The reasons for this are varied and can include increased oxygen needs. For example, in the case of hyperthyroidism, severe hypertension, or persistent tachycardia. Another cause is a decrease in oxygen supply. Possible triggers include heart or lung diseases. Consequently, not enough oxygen is delivered to the heart. Diagnosis of heart attack. What happens in case of suspected infarction? The first step is always the assessment of the risk of infarction, that is, the likelihood of a real infarction. This depends, of course, on age and sex. Since chest pain can occur in many different diseases, targeted questions about medical history and coronary artery disease risk factors are asked to assess the likelihood of a heart attack. At the same time, an ECG must be performed immediately, as it provides the most reliable information to determine if there is a heart attack or not. Next, a physical examination is performed. The heart and lungs are auscultated to detect signs of oxygen deficiency, such as pallor, cold hands, or a blue coloration of the skin and lips. If, after the initial examinations and ECG results, the suspicion of a heart attack persists, additional examinations such as echocardiography or coronary angiography are possible. Finally, blood tests are conducted. Cardiac enzymes, particularly troponin, the most important marker of a heart attack, are measured. This substance is released in large quantities and is found in higher amounts in the blood when a heart attack occurs. Troponin levels must be measured regularly, as they only increase about 3 hours after the infarction, which takes some time. However, heart attacks are not the only conditions that lead to increased troponin levels, which is also important. If you have no symptoms but high troponin levels, this does not necessarily mean a heart attack. This is why the real cause may be another illness, complicating the diagnosis and lengthening the list of differential diagnoses. Treatment of heart attack. As soon as it is clearly established that there is a heart attack, treatment must begin as quickly as possible. This depends on the type of infarction, STEMI or NSTEMI. In both cases, administering aspirin, acetyl salicylic acid, is crucial. In case of pain or agitation, opioids or sedative medications can also be administered, often already by the emergency physician. The emergency physician may administer diazepam for intense anxiety and morphine for pain. They also give medications like aspirin to prevent the blood clot in the coronary arteries from enlarging or new clots from forming, which thins the blood. Additionally, nitrates in the form of oral spray will be administered to the patient. These dilate blood vessels, reduce the heart's oxygen needs, and thus decrease pain, anxiety, and dyspnea. And what happens next? The patient's condition is constantly monitored by ECG, and oxygen saturation must remain above 90%. To restore blood flow, a stent is usually placed. This can be done directly in the cardiac catheterization lab. A stent is a small flexible tube that unblocks the artery and prevents a new blockage at that location. Sometimes, a balloon is used to dilate the blocked artery, allowing blood to flow again. If you liked the video, don't hesitate to give it a thumbs up and subscribe to my channel. For comments and opinions, write directly under the video. Thank you very much and stay tuned for Simplified Medicine.